Welcome back. We are joined by Stephen J. Pincus. He's a board-certified plastic surgeon talking about how to prevent a nightmare nose job. And if you haven't had one yet, if you're considering it, what you should do, this is a really popular procedure for folks in between the age of 16 to 25, right?
I think it's the most common procedure in teenagers and young adults, yes.
Okay.
Yeah.
So what should you do if you're considering it beforehand to make sure that you don't have a nightmare situation?
I think it's a good idea to get recommendations from people who've had rhinoplasties or nose jobs and take a look at the before and afters, see the doctor, see what his credentials are. Take a look at a lot of his before and after pictures to see his sense of aesthetics and how he can change the nose, and look at pictures that resemble your nose and see how he was able to change that, and if the results that he gets correspond with what you're looking for.
Let's take a look at some of the before and after pictures that you supplied for us just to get an idea. And just tell us, this is someone who had surgery, wasn't happy with the results, and then they had another surgery, accurate?
Correct.
Is that right?
Yes.
Okay. And what was wrong here?
The funny thing was, this was a girl who had done her due diligence in getting some breast surgery, and at the last minute, the doctor suggested that she have a rhinoplasty at the same time to sort of kill two birds with one stone. The only problem was he wasn't really that skilled in doing a rhinoplasty. So he had actually done way too much resections. Okay. And in the before pictures, we see that she has a very low bridge. The tip is way overly rotated. She has some depressions on the side of her nose.
See that little bump there on the side of the nose.
Yes, and she has a very bad scar between the nostrils in the area we call the columella.
Okay, and so then the after, that was able to be corrected.
Yes.
Let's move on to the next one and see what we're seeing in the next before.
Here's a case where somebody had way too much done. He's had multiple procedures on his nose, and you can see his nostrils look very bizarre and unnatural with retractions. And you can see these ridges that he has in the front part of his nostrils, which as a result of way too much surgery in those areas.
Okay, and then the after, this is when he went back, got another procedure, was able to get it corrected. Looks a lot better. Yeah,
we had to do a lot of grafting, and we had to rotate flaps of skin within the nostrils to remove those ridges, and actually had to put cartilage grafts into those ridges to fill them out. Okay,
Dr. Pincus, and just quickly, how much recovery time would you need for this, a nose job?
Believe it or not, it's about a week.
A week before you could be back to work?
Yes. I tell patients not to work out for about a month.
Okay.
But they can go back to work or school within a week.
Okay. All right. Thank you, Dr. Pincus, for joining us. We appreciate it. We'll see you right after this break.